Hello everyone, how are you all? I hope you all are doing good. Yes, so with that good note, we shall start our today's discussion. So, you know me well, I'm Ms. Manoranjini, your mental health nursing faculty, and this is the channel, your nursing companionship. Yes, so we are talking about series of information about schizophrenia. It is going to get completed. I have told in the previous video itself. Yes, so now we talk about this antipsychotics. What is antipsychotics under schizophrenia? So, this antipsychotic medications or the drug that are mainly used to treat psychosis and its related conditions. It helps to treat the psychosis and related its condition and its symptoms. Now, how do this antipsychotics works? Antipsychotics work by changing the certain signals in the brain, which is called neurotransmitters. We have seen the neurotransmitters which is responsible for schizophrenia in our previous video itself. Yes, and if these chemicals are out of balance, there is chance of developing the symptoms of psychotic symptoms like hallucinations and delusions. Yes, so when the neurotransmitters are changed or when the neurotransmitter remains imbalanced, what happens is there is a chance of developing the psychotic symptoms such as hallucination and delusions. Yes, so but the scientists are still learning how these antipsychotics help. They are thinking that it can be the reason that changing the balance of chemicals in the brain is become normal, so the symptoms are not seen. So what the psychiatrists think is that they do not know exactly how it is working, but this imbalance is being corrected by this antipsychotics, so the symptoms are being get reduced or it is not shown in the later phase of the disorder. Are there any different types of antipsychotics? Are there any different types of antipsychotics? Yes, there are. There are three types. That is first generation, second generation, and the newer generation. Yes, so what is first generation is? First generation drugs, this blocks the way the brain uses the several neurotransmitters. It blocks the brain how it is using the several neurotransmitters. Those neurotransmitters are dopamine, acetylcholine, and norepinephrine. Okay, they are especially dopamine. They also block acetylcholine and norepinephrine. These all are first generation antipsychotics. Next is second generation antipsychotics. These medication block the receptors like serotonin and dopamine, and they activate other serotonin dopamine receptors. They block the receptors like serotonin, dopamine, and activate the other receptors of serotonin and dopamine. Now we are going to see about next generation antipsychotic, and what is that? It targets the psychosis in differently. Yes, for example, the drug Cobenfy. That Cobenfy is the combination of xanomeline and trospium chloride. Xanomeline and trospium chloride, which is known as Cobenfy, which is newly approved by food and newly approved drug, which don't affect dopamine. So it has no impact on motor function and it won't make the person sleepy. It attaches to the specific receptor such as acetylcholine, and it affects the memory and cognition. Yes, it affects the acetylcholine receptors and it affects the memory and cognition. But it has fewer unpleasant side effects than traditional antipsychotics. So this is all about next generation antipsychotic. You need to know the name, that is Cobenfy. It is a combination of xanomeline and trospium chloride. It do not cause sleepy and it don't affect dopamine. Instead, it affects the acetylcholine and it causes cognitive and memory disturbances, and also it has the fewer side effects than the traditional antipsychotics, that is unpleasant experiences. So it is said that in September 2024, the FDA has approved, Food and Drug Administration has approved Cobenfy, an innovative new drug that offers fewer side effects compared to traditional antipsychotic medicines used in the treatment of schizophrenia.